Any reaction you've had from the Biden administration, Governor, on this?
Well, from them, they told me they would circle back, but they have denied giving us our permits that we need to host this event. And for me, I'm incredibly disappointed because it wasn't based on anything significant. We had met all the environmental checklists. We had the go, no-go checklist prepared and agreed to. We had consulted with our tribes. It appears to be a very partisan and political denial of our right to host this fireworks event.
All right, and Governor Christie of Alaska is now suing the Biden administration over blocking fireworks at Mount Rushmore on July 4th. You might recall last year with President Trump, he went to Mount Rushmore and the fireworks were on. There were no fires, there were no problems, there were no environmental issues back then, but no fireworks planned right now. We got Dr. Devi Nampiaparampil joining us now, the NYU School of Medicine, Metropolis Pain Medicine Director. Doctor, it's a gut call. You're a doctor. I mean, you're not in charge of fireworks, but is there a danger in a setting, anything having to do with the virus, let alone the fear of brush fires and all the rest, which the governor said had been addressed then and are addressed now? Is there a danger to people being packed together for fireworks at Mount Rushmore outside July 4th?
There's always a risk of catching the virus. I mean, when people are in a crowd, the question is whether it's acceptable or not, but people have a choice about whether to attend. And, ultimately it's up to the people who attend and up to the governor and up to the government there, the tribes and the local government, what they want to do. So I agree with her that there should be clearer criteria about what constitutes like an approval or a denial.
You know,
or how it's being determined.
I do get, right, but I get mixed messages from, all sorts of medical authorities on the mask thing, wear it, not wear it. The president wasn't wearing a mask when he spoke to the nation. Behind him, obviously the vice president and the speaker were. Confusing signals out of the CDC about be careful, going back out in America, traveling, but okay with cruises resuming in this country in July. I'm just wondering, do those inconsistent signals, do more harm than good?
Well, I think that's the biggest problem that we have, the inconsistent signals. I think what we should have is some type of criteria, not necessarily numbers of cases or percentages, but some type of criteria for whether something can take place, kind of like we have a constitution and then we have the Supreme Court that's there to interpret it. Because right now what happens is that each thing is being considered on a case-by-case basis. The CDC is often looked at to make a decision, and there's not necessarily consistency from one event to another. So, for example, in this situation with Mount Rushmore, this is an open-air space. Of course, people have a risk of catching a virus. That's always there. But open air, you have much less risk than if you consider a cruise ship. So I'm not against the cruise line industry, but relatively, one is open air and one is more contained. So you have more chance of getting real outbreak as well. Then we look at sort of the criteria that are being used. So, for example, with the cruise ships, what the CDC has said is that 95% of the passengers can be vaccinated and 98% of the staff have to be vaccinated. And that's one of the criteria for them to operate. But then to me, that seems like an extremely high target. I don't know if that's realistic. So is that really allowing them to operate, or is that just in name only? Because if you say 95% of the passengers have to be vaccinated, this is one of the alternatives. If 95% of the passengers have to be vaccinated, that's pretty much the same as a vaccine passport, which the Biden administration has said that they are not in favor of, especially when there's a disparity in terms of the distribution of the vaccines. And if you think about the staff, that's the same as saying, essentially that the staff has to get vaccinated. Or if you think about the cruise ship industry, where you have international staff as well, well, we have a lot of countries that are not able to administer the vaccine, especially if you think about India or all the 92 countries that it has promised to supply and the countries that it has already supplied. So are you trying to promote American jobs, or is this just another inconsistency, as you mentioned?
All right. Doctor, thank you very, very much on that. And by the way, we got a lot of email on this and cruise lines coming back. One particular viewer, Arlene, saying, Neil, are you seriously taking credit for cruise ships returning to the seas simply because you had the Norwegian Cruise Line CEO on your show? Yes, I am, because he went on a couple of times, and he said that he is requiring all who work on his ship and all who board his ship have proof that they've been vaccinated. He came on, pounded that. We got a lot of email on it. So, fast forward, the CDC is now saying cruise lines can operate. So you're welcome for that. I didn't like the snippy comment, but I'm trying to save the country at the same time I'm reading a prompter, which is not easy to do. A little more to this.